When a patient stops breathing normally and his heart is beating erratically or not at all, you can substitute manual chest compressions for the heart's normal pumping action to circulate blood through the body. The blood you push through the patient's body will carry some oxygen to important organs. Your willingness to respond may increase the patient's chance for survival until emergency medical service personnel arrive. CPR is a two-step process. Step 1, chest compressions, followed by Step 2, rescue breathing. In this skill, you'll learn how to perform chest compressions. If you are unable or feel uncomfortable giving a patient the rescue breaths, relax. Give the patient immediate and continuous chest compressions. Chest compressions alone are very beneficial to an unresponsive patient who is not breathing normally. Your efforts will still help circulate blood that contains oxygen. Begin, as usual, by assessing the scene for safety. Next, check the patient for unresponsiveness by giving the responder statement.
Hello, my name is Penny.
If there is no response to your statement, then tap the patient on the collarbone and ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing. Here's an important note about normal breathing. In the first few minutes after cardiac arrest, a patient may be barely breathing or taking infrequent, noisy gasps. This is often termed agonal breathing, and these gasps must not be confused with normal breathing. Many patients in cardiac arrest make these gasping sounds. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical services, then you provide assistance.
1, 2, 3, 4, 5,
Now,
6, 7,
position the patient on his back if not already in this position. If necessary, expose the patient's chest. Find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers. Use the palm of your hand on the compression site. Keep your fingers off the patient's chest. Next, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows, like this. Now deliver the chest compressions. Keep the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters, 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. With your instructor, you will practice chest compressions using a CPR mannequin. Do not perform chest compressions on someone who does not need CPR.